every one of my clients, every one of my friends, everyone is like in 2020 and 2021, we saw a lot of people, corporate CEOs running on treadmills and collapsing of heart attacks. And I thought, who better than to invite Dr. Ashish, who's the race medical director in the Mumbai marathon. So if any marathon happens and we are running over there, Dr. Ashish is the guy that's saving our life. Hopefully you don't get a heart attack when you run. So Ashish, my first question to you, doc, is it okay to exercise in 2022?
Thanks, Ryan. It's actually quite sad and quite ironic that over the last year, because we've had these unfortunate events, we are being asked the reverse question. Normally, people should ask, "Oh, is it bad not to exercise? How can I or my loved one exercise?" And today, over the last year and a half, people are asking the question in reverse. So give me a couple of minutes to talk on this subject because it's something which you can't have a one-liner on. And ironically, since the last 4 5 months, I've done probably 10 different podcasts and events such as this around this subject. And let me distill it down for you. Exercise is absolutely fabulous. If we could put all the benefits of exercise into a pill, it would probably be the best-selling pill ever. Okay, apart from your heart, stroke, cancer, pretty much every chronic disease known to man, exercise reduces your risk of getting it. And if, God forbid, you have got it, exercise improves your quality of life and reduces your chance of it becoming worse. That's in a nutshell. Okay. Having said that, exercise does not provide immunity against heart attack and death. And this is where people make a mistake. Just because someone is exercising does not mean they cannot have an event. Since we are talking about the subject of heart, there are different risk factors which contribute towards a person having a heart attack. Okay, the usual ones, which I'm sure you've spoken about several times in the past: smoking, diabetes, high blood pressure, high cholesterol, heavy weight, genetics, and last is lack of exercise. So obviously, if you're exercising, you're getting rid of one risk factor. But doesn't mean that you cannot have. Now, all these people who unfortunately died young, I cannot comment on what their risk factors were because I do not know it. But I just want to say that just because you're fit does not mean you have immunity. You have protection, but not immunity. And that's what people need to understand. One final point: when people who are very well known have an event, it also makes disproportionate news in the headline. When people are
Yes.
exercising and they have an event, it makes disproportionate news. You rarely read in the newspaper somebody sitting at home watching TV has a heart attack, doesn't make the news. But if the person was in a gym or outdoor exercising, it does make the news. So
So,
exercise is beneficial.
So, Doc, you used a very important point, and I want to ask the maximum number of questions before I let you go. I know you're very busy at the
Yeah.
hospital. You said immunity doesn't confirm immunity. So Ryan Fernando wants to work out in 2022. Doc, I want immunity. What are the things that I should test for? Or can I come and visit you at HN Reliance Hospital? And can you get me running on a treadmill? What do I need to do in 2022?
So, you're most welcome to visit. You've been threatening to do that for the last 5 years, but you haven't yet done it. But so here's the point. I think to start with, every adult should know some very basic numbers. Okay, you must know your height and weight. I know I'm stating the obvious, but there are so many people who don't. You must know at least once a year your blood pressure, your cholesterol, your sugar. These are all simple things which can be done with one simple, inexpensive blood test and somebody measuring your blood pressure. The problem is these are all silent issues. All these three big ones: blood pressure, cholesterol, and sugar. If your numbers are way high, you won't know it until you measure it. So if you ask a room full of people, do you have high cholesterol? Very few people may put their hand up. But then if you ask them how many of you have actually measured it in the last 1 year, again, very few people will put their hand up. So you can't assume you've got good cholesterol or sugar or blood pressure until you measure it. So this is the minimum testing you need to do once a year. Now, if any of these numbers come high, then yes, you need to test further. Something else, two more points I would add: if somebody has a strong family history of heart disease, By that, I mean a direct relation, mother, father, brother, sister, has has died young. When I say young, say below the age of 60, not just had a heart disease, but died young below the age of 60. That would be a sort of a alarm bell in my mind. So speak to your doctor. He or she may want you to do further tests. If you want to embark on vigorous exercise, right, not just a simple brisk walking program, if you want to embark on in vigorous exercise, talk to your doctor to see whether additional tests are required or not.
Okay, so that's awesome. Um, Most of the people that work with Shwetambari in terms of fitness, all of us are in this young age of 40 to 60, and we feel we are invincible. We're doing this cholesterol test, but they still do a workout and go down to the pub and then have all that unhealthy food and stuff like that. What more should they do? Because I'm seeing people coming with ESR, C-reactive protein, lipoprotein A, lipoprotein B, all of this is high. HbA1c is also high. Will meeting a cardiologist as a preventive factor, and will maybe screening for genetics from that perspective help a client?
Okay, so you hit a good point. So there are a lot of people who are very fit, but they engage in unhealthy behaviors. Okay, so again, you may be very fit, you may play a great game of tennis or squash or run a quick marathon, but you may still be smoking, for example. So, you need to take care of your health behavior. There's another very well known phrase which you'll identify with, which says you cannot outrun a bad diet.
True.
So just because you're running mile after mile doesn't mean people say, oh, he's so thin, he's so fit, he can eat anything. No, you cannot eat anything just because you look fine or if you exercise. Some of the things you mentioned, your lipoprotein, small a, ESR, C-reactive protein, a lot of them are markers of what's called inflammation in the body. And there are sort of theories that inflammation is the genesis of a lot of heart disease and other diseases as well. So yes, under the guidance of a good nutritionist, a good doctor, further testing would be helpful, especially if you have a family history. I don't suggest a specific set of tests which everyone needs to do without talking to their doctor, but all the tests you mentioned are for some of the newer risk factors, like you mentioned, lipoprotein, small a, homocysteine. In the right subset, they should be measured.
So I have questions coming in live because we're going off Facebook and
Sure.
LinkedIn. And
Let's see.
somebody's asked, Doc, what is the difference between a stroke and a heart attack?
Okay. So let me tell you the difference between not only a stroke and a heart attack, but also a cardiac arrest and a heart attack that people get more confused with.
Oh,
So
even I
first,
don't know the difference between the
okay,
two.
yeah. So stroke, first of all, the same way a stroke is a brain attack. It's very simple. When we say heart attack, is because there are blockages in the heart arteries and a blockage erupts and that causes a heart attack. Similarly, when you have a problem in the brain, the artery, there are two types of strokes. One is called hemorrhagic, when the blood vessel ruptures. That's about 5 to 10%. The other is when there are blockages. That's called ischemic, which is more common. So stroke in simple words is a brain attack. Okay, same way as a heart attack, there's a brain attack. Same risk factors, blood pressure, cholesterol, diabetes, smoking, all the usual suspects. Let me tell you the difference between a heart attack and a cardiac arrest. Cardiac arrest, as the name suggests, is when the heart essentially stops beating or stops functioning. So pretty much everyone before their final breath, so to speak, they're in a cardiac arrest. Now, a heart attack is the commonest cause of a cardiac arrest, but every heart attack does not lead to a cardiac arrest. Okay, 1 out of 3 heart attacks tend to kill people on the spot, and they probably lead to the cardiac arrest. At the same time, a heart attack is not the only reason for someone having a cardiac arrest. Let's say you put your hand in a big electrical system and you get electrocuted, you will go into cardiac arrest. A lot of the deaths that we see in young people, and young, I would probably draw the line at 25 to 30, like we saw happen with the Danish footballer during the Ericsson during the Euro.
Yes. And also recently one Indian cricketer just collapsed and died.
Those are cardiac arrests happening. The press wrongly reports them as heart attack. Those are not because of cholesterol, BP, etc. in the younger age. they are usually because of some abnormality in the structure of the heart, often genetic in nature. Commonest are what are called cardiomyopathies,
Hmm.
or some of the arteries are coming out of a wrong position. It's called the anomalous origin of a coronary artery. Or many of them are unknown, where the heart suddenly goes into what's called an arrhythmia, an abnormal heart rhythm. So those lead directly to a heart attack, sorry, a cardiac arrest without a heart attack. Okay, so that's the
So doc,
difference.
if somebody has, like you said, no, a family member or something, or maybe they've done a genetic test and they figure out that they have the cardiomyopathy gene or the atrial fibrillation gene,
Yes.
or these things that are being identified in today's world, when they come and meet you, what is it that you are looking for in such people, and then what is the advice that you're giving them in terms of, I think the biggest factor today is fear, because we have all of this knowledge to test, but then I think people bring upon the disease upon them by just manifesting a negative event.
Yeah.
So how do you comfort people,
True.
how do you guide
So,
people?
in most of, let's first talk about the standard, if I may use the word standard heart disease, which is the blockage, the stuff that we most talk about, so technically called coronary artery disease. That always benefits with exercise. How much exercise at the right time is, of course, what we discuss with the client or with the patient. Now, when you're talking about some of these cardiomyopathies, there are some, if we see that in the patient, in the client, rarely do we have to tell them to stop exercise. We often need to tell them that they will have to stop competitive exercise at the highest level if they've got these cardiomyopathies. But usually, most can do regular recreational exercise. So that's when the expertise comes in to decide who should do everything normally without any stop, who should exercise recreationally but not competitively, and which is that very small subset which should not do anything at all until further workup happens.
I'm smiling, Doc, because I think the film stars go into a very competitive mode when they want to morph their body, and they really aggressively push the body. And then there's the diet, which is restrictive. And then you have various trainers or people giving advice: don't drink water, cut out on sodium so that your skin looks better for the movie shoot. And I think this influences the rest of the population. So the point I think that I should rephrase is that check with a doctor on the intensity that you should work out at, competitive or recreational fitness. And to ask you another question, would an exercise wearable that tracks your heart rate help people work out in the correct heart training zone, which puts lesser stress on the heart?
I think so. I think today wearables have really changed the face of the way we measure, the way we quantify the human self. They need to be used sensibly. Now, there are people who also then get drowned in data and get drowned in numbers. So that's the little care you need to take. There's actually a fabulous company, coincidentally based right out of your Bangalore, called Fourth Frontier. And I've been using their devices. They got a heart rate strap called the Frontier X, which actually not only transmits the heart rate, but it also transmits the ECG. This is
ECG.
the first of its kind, pretty much, that I've seen in the world, and I've been looking for years and years, which transmits a live ECG and a very good quality ECG. In the past, whichever things I've worked with, the ECG hasn't been that great. So if you've got a specific heart condition, then exercising with a device like this, which measures the ECG, is fantastic. If you don't have a heart condition and you want to use heart rate training just to be more scientific, then any wrist-worn device, or there are several today available, and most have a reasonable degree of accuracy, can be used. The data needs to be used intelligently. You need a right coach, a right guidance as to what your heart rate guidelines should be. And you got to also just make sure that you don't get drowned in data. Often people get drowned in data and they forget the actual thing, which is go out and do something.
Something.
Wait for that perfect workout, the perfect diet, and in between they don't do anything. So that is a problem.
Speaking of not doing anything, I got one or two more questions before I let you go. I know you have a
Yes.
busy day.
No, no, take your time.
What prompted you to write this book, The Hard Truth? And I'm going to put the link up for people to buy, because when I
Sure.
read that book, it gave me an eye opener because I did my genetic testing and I've got like 60% of the Indians, according to the gene lab, 60% of the Indians have the predisposition to heart disease.
Yeah.
So I was reading your book and you talked about the perfect weight is important.
Yeah.
If you look at a person, and I'm being very cheeky over here, you must be seeing
Yeah.
thousands of patients, right? So somebody comes in, you just look at, I think this guy is a probable heart attack person. Are looks deceiving? Like you see a fat man with a visceral fat belly. What's your experience from an eye perspective to catch a person? Or you're at a party, I invite you to my next year's newer party, and we have 500 people over there, and Aashish Contractor goes, heart attack, no heart attack, heart attack, no heart attack. Is it possible that way?
Okay, so you're asking two separate questions. I'll answer them one after the other. In terms of, can you judge a book by its cover? In my practice, I've learned that you can often be wrong.
Okay.
We normally go by this thing that thin is fit and fat is unfit, which is not true. Of course, if you took a room of 100 people and you divided them by BMI, usually the ones who have the healthy BMI will, as a group, be healthier than the ones who have an unhealthy BMI. But there's a huge variation within that range. I have found that there are a lot of people who are overweight. I'm not talking about completely obese, say BMI 25 to 30 in that zone, but who exercise regularly. They're metabolically fit, their sugars, their cholesterol, all their numbers are in great order. It's just that they're carrying a few extra kilos. They're trying their best. They're even maybe eating healthy, but you know what? They're still walking around with some weight. And then there are people who look very thin, but just because they're thin doesn't mean that their numbers are perfectly in order. So I may not know just by looking at them, but by maybe observing them for half an hour and looking at their plate, I might get a little more inkling. But I've been horribly wrong several times, so I don't even want to go there.
Shwetambari, do you have any questions for doctor?
Well, I think the question that I've been getting in the recent past, owing to all those incidents of heart attacks, doctor, is really about overtraining. And I just quickly wanted to, ask you this question. What is overtraining? In a sense, we say that you should work out anything between 30 to, 50 minutes, max an hour a day, and then be active through the day and not just, be sitting around. But I've seen a lot of the ones like between the age of 30 and 40 or 25 to 35 sometimes do like 2 hours, 3 hours of rigorous training. And I think at a slightly younger age, you may not feel the burnout as much. But can I relate that to eventually not being good for the heart?
Okay, so you asked a great question. Let me quickly answer Ryan's earlier question. What prompted me to write the book? So
Yeah.
in my cardiac rehab practice, we used to see, I must have seen over 10,000 people come and go, and I decided that a lot of people, they have hundreds of questions, but the questions tend to be very similar. So I wrote the book in a very colloquial fashion. These are my experiences of dealing with my patients, and they usually have the same questions. So I've tried to, in a conversational style, address about 500 of the commonest questions that they've had over time. And I found that was very useful. So now when people come in, I say, if you like, you can read the book. That'll answer a lot of the questions that you have. And I promised myself before I turned 40, I will write a book. So that was the reason for the book. And I'll run a sub 145 half marathon. So both those promises have been kept. And that was
Wow.
exactly 10 years ago. To answer Shwetambari's question, okay, this question of over exercising and overtraining is a great question. Let's look at it in two ways. We can do what's called acute or chronic. Acute means over exercising like in a single session, right? A session of 2 hours, 3 hours, how much you go, right? That's an immediate acute overtraining. The second is chronic. Chronic meaning over months, over years, someone who's running 100 kilometers plus week after week for many years. Someone who trains in the gym 2 hours a day for week after week, year after year. So if someone builds themselves up sensibly, right, starting with the very standard 30 to 60 minutes moderate intensity exercise 4-5 days a week, and you keep building up. Rule of thumb is not doing more than 10% increment over your previous week. If you do that over time, a person, the human body is capable of great achievement. Okay. I used to once growing up think that, oh my God, 42 kilometers is impossible. For the last now 7 years, I've been doing one full marathon every year. But the human body can build it up. So
Yeah.
that isn't a problem. But if I wake up, a lot of people are the weekend warriors. They're not doing much. And then suddenly on a Sunday, they decide today we'll go and ride for 4 hours. Today we will, run for 2 hours. That is a problem. Okay. So when you push yourself, so overtraining is pushing an unprepared body for the task at hand. That's very important. There are two people. Somebody may run 1.5 hours, and that may be overtraining because that person never run more than half an hour before in their life. Or someone may run 4 hours, but they've been doing between 3 and 3.5 hours for the last 6 months. So for that person, that 4 hour run wasn't overtraining to the position they had built themselves up with. But the guy who ran 1.5 hours, who's used to half an hour, is overtraining. Why? The guy who ran 45 minutes when he's never run before is overtraining. Okay. So acute overtraining has got to be seen in light of the conditioning of the person. Okay. That's important. Chronic overtraining. This is where it gets interesting. Is there something like too much overtime? So earlier the answer was there really isn't too much. What they're now discovering that people who are putting in large volumes of endurance training over many years, they sometimes tend to have higher amounts of what's called atrial fibrillation. They sometimes have a little more scarring on the heart muscle. Having said that, we've still not figured that is that more dangerous in any way. So the jury is out there that is there something like the ill effects of chronic overtraining, number one? And if there is, what's the magic plan? Now, please let me emphasize, these are people who have been doing like on an average 40, 50, 70 full marathons, ultra marathons. So by no means the average person that you and I see in our practice. So there's no need for people to panic. But there is of late, last 5-7 years, scientific light looking at this. Okay, so that question is under study. As of now, we haven't defined that.
Sure. Thanks, Doc.
You're on mute, Ryan.
Sorry. There's a question from a person watching us, Mr. Patel, asking with relationship to triglycerides. Even after a safe diet, no outside food, and exercise, still my triglycerides, visceral fat levels often shoot up. What may be the reason?
Okay, so the diet part I'll leave to you, but just one quick point: just because you don't eat outside food, that doesn't necessarily mean that you're eating healthy food, right? The average Indian diet, especially the vegetarian diet, tends to be very high in carbohydrate. And I'm not an anti-carb person like the fad is today, but the point is the average Indian diet tends to be very high in simple sugars, just a lot of rice, bread, chapatis in the diet as opposed to vegetables. So though, the person may be vegetarian, the amount of vegetables, which is great for you, is not eaten in large quantities. In my experience, Indians tend to have high triglycerides and low HDL, along with that visceral fat. It's that classic insulin resistance syndrome, metabolic syndrome, syndrome X, which I'm sure you're very familiar with. I have found that reducing the simple carbohydrates, simple sugars in the diet definitely helps. Exercise helps reducing visceral fat and triglycerides. So I think if you're consistent over time, you will definitely get benefits in reducing triglycerides with a little bit of weight loss, regular, not just exercise, as Shwetambari said, also including physical activity as part of your daily life. Okay, there are people who go to the gym 1 hour a day and spend 23 hours being inactive. So that's also not good. So being physically active, exercising, reducing simple sugars in the diet, all of these will go towards reducing triglycerides and visceral fat as well.
Wonderful. Doc, I think we have taken more than time that you have taken. You're required back at the hospital. Thank you for joining us today, and a million thanks.
Wonderful.